So it's great to talk about the BRIDER trial. This is a second-line study in gastric cancer in patients who've progressed on a non-Taxol-based first-line regimen. So as you know, gastric cancer is a tough disease. Median survival is a year or less for most patients, and so we're looking always for new treatments. The BRIDER trial focuses on a brand new drug that specifically inhibits phospho-STAT3, which is important in the stemness of cancers. And based on preclinical data as well as an early clinical trial, there's really very encouraging activity of this STAT3 inhibitor with chemotherapy. So this is a very straightforward, I think, well-designed study that's a randomized phase 3 study of Taxol versus Taxol and BBI608, which is the STAT3 inhibitor. The primary endpoint is overall survival. They're also looking at a predictive marker for activity, specifically phospho-STAT3. In an earlier study in colon cancer, there was a very strong suggestion of benefit in patients who are phospho-STAT3 positive. So I think that the study overall is quite interesting. It has the chance to move the bar, and I think most importantly, it investigates a new treatment paradigm for cancers, not only stomach cancers, but all cancers that have a cancer stemness phenotype. Let me tell you about some key eligibility for the BRIDER study. Since the randomization is to Taxol or Taxol with the investigational drug, patients who receive Taxol in the first-line setting or who have received Taxol in the adjuvant setting but then progress within 6 months would be ineligible. We're really looking for a potentially taxane-sensitive population. But then once you're eligible, you can receive either Taxol plus a placebo or Taxol plus BBI608. The drug itself is a pill that you take twice a day. It's generally well tolerated. The main side effects are diarrhea and nausea, but it seems to be because of the packaging, not the actual drug. So if you stop the medicine for 1 or 2 doses, you're back to your baseline. So I think overall it's a well-designed study, drug with a good safety profile, and we're hopeful that will accrue quickly so that we can have the results in the next year.